How to use Abilify. Read the medication guide and, if available, the patient information leaflet provided by your pharmacist before you start taking Aripiprazole and each time you get a refill. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. The dosage is based on your medical condition, response to treatment, age, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. To reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. Follow your doctor's instructions carefully. The manufacturer directs to swallow this medication whole. However, many similar drugs, immediate-release tablets, can be split, crushed. Follow your doctor's direction on how to take this medication. If you are using the liquid form of this medication, carefully measure the dose using a special measuring device, cup. Do not use a household spoon because you may not get the correct dose. Do not increase your dose or use this drug more often or for longer than prescribed. Your condition will not improve any faster, and your risk of side effects will increase. It may take several weeks before you get the full benefit of this drug. Use this medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. Keep taking this medication even if you feel well. Do not stop taking this medication without consulting your doctor. Some conditions may become worse when this drug is suddenly stopped. Your dose may need to be gradually decreased. Tell your doctor if your condition does not improve or if it worsens. Side effects. See also warning section. Dizziness, lightheadedness, drowsiness, nausea, vomiting, tiredness, excess saliva, drooling, blurred vision, weight gain, constipation, headache, and trouble sleeping may occur. If any of these effects persist or worsen, tell your doctor or pharmacist promptly. Dizziness and lightheadedness can increase the risk of falling. Get up slowly when rising from a sitting or lying position. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects, including fainting, mental, mood changes, such as increased anxiety, depression, suicidal thoughts, trouble swallowing, restlessness, especially in the legs, shaking, tremor, muscle spasm, mask-like expression of the face, seizures, trouble controlling certain urges, such as gambling, sex, eating or shopping, interrupted breathing during sleep. This medication may rarely make your blood sugar rise, which can cause or worsen diabetes. Tell your doctor right away if you have symptoms of high blood sugar such as increased thirst, urination. If you already have diabetes, check your blood sugar regularly as directed and share the results with your doctor. Your doctor may need to adjust your diabetes medication, exercise program, or diet. This medication may rarely cause a condition called tardive dyskinesia. In some cases, this condition may be permanent. Tell your doctor right away if you develop any unusual uncontrolled movements, especially of the face, mouth, tongue, arms, or legs. This medication may rarely cause a very serious condition called neuroleptic malignant syndrome, NMS. Get medical help right away if you have any of the following symptoms: fever, muscle stiffness/pain/tenderness/weakness, severe tiredness, severe confusion, sweating, fast, irregular heartbeat, dark urine, signs of kidney problems, such as change in the amount of urine. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including fever, swollen lymph nodes, rash, itching, swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Precautions. See also warning section. Before taking Aripiprazole, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. This product may contain inactive ingredients, such as propylene glycol, which can cause allergic reactions or other problems. Talk to your pharmacist for more details. Before using this medication, tell your doctor or pharmacist your medical history, especially of problems with blood flow in the brain, such as cerebrovascular disease, stroke, diabetes, including family history, heart problems, such as low blood pressure, coronary artery disease, heart failure, irregular heartbeat, nervous system problems, such as dementia, MS, seizures, obesity, low white blood cell count, including history of low white blood cell count caused by medications, swallowing problems, breathing trouble during sleep, sleep apnea. This drug may make you dizzy or drowsy or blur your vision. Alcohol or marijuana, cannabis, can make you more dizzy or drowsy. Do not drive, use machinery, or do anything that needs alertness or clear vision until you can do it safely. Avoid alcoholic beverages. Talk to your doctor if you are using marijuana, cannabis. This medication may make you sweat less, making you more likely to get heat stroke. Avoid doing things that may cause you to overheat, such as hard work or exercise in hot weather, or using hot tubs. When the weather is hot, drink a lot of fluids and dress lightly. If you overheat, quickly look for a place to cool down and rest. Get medical help right away if you have a fever that does not go away, mental, mood changes, headache, or dizziness. Liquid preparations of this product may contain sugar. Caution is advised if you have diabetes. Ask your doctor or pharmacist about using this product safely. Older adults may be more sensitive to the side effects of this drug, especially seizures, drowsiness, dizziness, lightheadedness, confusion, tardive dyskinesia, swallowing problems, and other serious, rarely fatal, side effects. See also warning section. Drowsiness, dizziness, lightheadedness, and confusion can increase the risk of falling. Before having surgery, tell your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, this medication should be used only when clearly needed. Babies born to mothers who have used this drug during the last 3 months of pregnancy may rarely develop symptoms including muscle stiffness or shakiness, drowsiness, feeding, breathing difficulties, or constant crying. If you notice any of these symptoms in your newborn, especially during their first month, tell the doctor right away. Since untreated mental, mood problems, such as bipolar disorder, schizophrenia, can be a serious condition, do not stop taking this medication unless directed by your doctor. If you are planning pregnancy, become pregnant, or think you may be pregnant, immediately discuss with your doctor the benefits and risks of using this medication during pregnancy. This medication passes into breast milk. Consult your doctor before breastfeeding. Consult your pharmacist or physician. Interactions. Drug interactions may change how your medications work or increase your risk for serious side effects. This document does not contain all possible drug interactions. Keep a list of all the products you use, including prescription, non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. A product that may interact with this drug is metoclopramide. Tell your doctor or pharmacist if you are taking other products that cause drowsiness such as opioid pain or cough relievers, such as codeine, hydrocodone, alcohol, marijuana, cannabis, drugs for sleep or anxiety, such as alprazolam, lorazepam, zolpidem, muscle relaxants, such as aripiprazole, cyclobenzaprine, or antihistamines, such as cetirizine, diphenhydramine. Check the labels on all your medicines, such as allergy or cough and cold products, because they may contain ingredients that cause drowsiness. Ask your pharmacist about using those products safely. Overdose. If someone has overdosed and has serious symptoms such as passing out or trouble breathing, call 911. Otherwise, call a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222. Canada residents can call a provincial poison control center. Symptoms of overdose may include very fast heartbeat, loss of consciousness. Notes: do not share this medication with others. Laboratory and/or medical tests, such as blood sugar, weight, cholesterol, triglyceride levels, may be performed before you start treatment, periodically to monitor your progress, or to check for side effects. Consult your doctor for more details. Missed dose. If you miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Take your next dose at the regular time. Do not double the dose to catch up. Storage. Store the tablet in the oral liquid at room temperature away from light and moisture. Discard the oral solution 6 months after opening or after the expiration date, whichever comes first. Do not store in the bathroom. Keep all medications away from children and pets. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product when it is expired or no longer needed. Consult your pharmacist or local waste disposal company.